They offered so many therapies, and the staff presented this rose-tinted view of what this assessment and treatment unit was going to be like.
You're listening to Patient 11, a new 4-part podcast investigation from Sky News and The Independent. This is episode 3.
I packed my bag again and we drove, as usual, a couple of 100 miles away from home because there's nothing, close to home for autistic people. And we pulled up to the hospital.
And with Alexis now having told the couple who would one day help her escape, the former doctor, David Forsyth, and his partner, Jenny Middleton, that she'd agreed to be admitted to a secure assessment and treatment unit supported by the NHS at Bedfordshire's Milton Park, Alexis arrived at the unit in late 2014.
There was like a little sort of ponded area where people at the weekend would go fishing. That kind of setting, that sort of calmness, that sort of serenity, that's something that I hadn't had before, in other inpatient units.
For Alexis, most of the last 2 years had been spent locked up away from her daughter. She complained of sexual violence and isolation.
And for some reason, I still had some hope. I just knew that this was a specialist autism hospital. It was going to get me better.
Now, having finally been diagnosed with autism, Alexis hoped that this time, things were going to be different.
And we were met by a very warm, nice receptionist. And I was shown through to the the intake area, I suppose. And it was then, really, that things started to change. As soon as that door shut, I ceased being the mother that had just given all those Christmas presents and had a wonderful, normal family time at home. And all of a sudden I became this patient again, this thing that needed to be controlled, that was a risk. My shoelaces were taken, my belt was taken, my jewellery was taken off. They tried to take my phone, but that's my only lifeline to my daughter. And so I resisted that, knowing that they could restrain me, knowing that they could medicate me and seclude me.
And just hours after walking into Milton Park, Alexis's worst fears were realised when she was again sectioned and detained, having fled the facility after being told she couldn't leave.
The ward car was chasing me. I was petrified because this had never happened before. Nobody had been chasing me in a car and was shouting at me. I had no idea who these people were, having only been in the hospital for a short time. And then when I crossed the road and I got to the other side, they had obviously called the police. And the police came, and without speaking to me or without any conversation, they tackled me and threw me into the back of the caged police car. And I was driven, to my absolute surprise and horror, back to the hospital. Again, no law to hold me, having committed no crime whatsoever. And at that point, the hospital put me in something called long-term segregation, which is where you're locked in a space away from all other people. And you're not allowed to leave until they decide that you can.
Long-term segregation, under the Mental Health Code of Practice, means a patient can be locked in solitary confinement if it's believed they pose a risk to themselves or to others. The code recommends only short periods of isolation. Now, Alexis would spend 8 days alone in a unit she'd entered voluntarily.
It's a small room, a few metres by a few metres, and there's nothing on the walls. They're plain white. There's a small window and a thin mattress with one pillow, but there's no blankets, there's no cover. I had nothing in there. No means to communicate, no phone, no pen, no piece of paper, other than to bang on the window, bang on the door and scream. It was by the food that I got really is that I knew kind of what time of day it was. Staff would make me go to the back of the room. They would unlock the door and they would put the food on the floor for me, and then they would quickly lock back up the door with staff looking at me through the window. When I was in the room, I could hear sometimes other patients screaming. There was clearly a seclusion room on the other side of the wall, and so I often heard a man that was in there quite regularly every day or evening, I don't know what the time was, screaming and screaming and screaming. You could hear doors banging, you could hear the alarms. And I was in there for 8 days, but really an hour just felt like a day, you know, and a day just felt like a week, and a week just felt like a year. Time passed so slowly.
Milton Park Therapeutic Campus is now closed. And shortly after Alexis was taken out of solitary confinement in 2015, the Care Quality Commission, or CQC, the independent regulator for social care providers, identified a number of safeguarding issues at Milton Park.
There were no effective systems for identifying, capturing and managing issues and risks at unit and organisational levels.
Chief among concerns were measures relating to segregation or solitary confinement and restraint.
Staff did not use long-term segregation correctly.
Significantly, the CQC would, before long, roll out a sexual safety inspection of all NHS England psychiatric care facilities. As a result, the Department of Health backed a new set of protections known as the Sexual Safety Collaborative, a framework designed to keep patients like Alexis and staff safe from sexual attack.
We don't have a definitive study showing the correlation between, mixed-sex wards and the number of incidents. But we do know from the CQC report that they were more likely to occur in mixed-sex wards.
Charlie Brooker is an honorary professor of criminal justice and mental health at London's Royal Holloway University.
If an inquiry was set up to look at sexual safety on mental health inpatient wards, it would be fascinating to see how many people came forward and wanted to give evidence. I wouldn't be at all surprised if it wasn't several thousand. Because I've been asking this of NHS England, has there ever been an audit of these standards? Twice I've asked that question and twice they've fobbed me off.
Since this conversation and our discovery of more than 800 allegations of sexual assault involving female patients like Alexis, we asked all NHS England mental health trusts, more than 50 of them, to provide evidence of how this safeguarding framework is currently being applied. To date, only 6 trusts from 38 respondents have shared their audits. And out of the alleged 800 sexual assaults we've identified involving female patients, we now know that just 95 were definitely reported to the police.
People commit offences like assault or sexual assault or things like that, and it's just put down to being disinhibited to do with, their illness and their struggle. I blame the system for putting me in that situation, for not safeguarding me.
Meanwhile, back at Milton Park in 2015, Alexis told us she was scared to report sexual safety complaints. She has made other disclosures outside of her 2 complaints. However, they were never formalised because Alexis believed they wouldn't be taken seriously and may limit what access she had to her daughter.
Your leave might be taken away from you because you make quote-unquote allegations, and that could affect you for months. And as I say, when you do tell staff, you're disbelieved. So there's just no point. So a lot of it goes unreported anyway.
Nonetheless, Alexis was about to come under even greater scrutiny because owing to concerns she may escape, as well as a threat that she may self-harm, she found 2 members of staff assigned to her side 24 hours a day. Everywhere she went, everything she did, even showering, was now watched over, sometimes by male staff members.
It's called 2-to-1 arm's length obs. I could go in the garden if staff held me in a restraint, 1 on each side of my arm. When I went to the toilet, they were an arm's length away from me, so 2 people had to watch me go to the toilet. 2 people had to be an arm's length away from me if I wanted to have a shower, so they had to wear these kind of waterproof shower outfits while I was in the shower. If I wanted to go to the therapies that I was promised, I had to be held in a restraint to walk across to the other building. They sort of lasted for 1 hour a day, and the rest of the time I was just there doing nothing. My every moment, my every move watched and controlled by staff.
From Milton Park, Alexis was eventually transferred to a lower security psychiatric care unit in Ramsgate.
Well, I remember particularly complaints about assaults, about being treated like some sort of prisoner and locked away with no right of appeal forever, as far as we could tell.
It was through this period that family friends Jenny Middleton and then Dr. David Forsyth, who would soon help Alexis escape, learned of her story.
It seemed totally outrageous. A person who'd had their rights completely taken away from them.
And though her condition had improved and she was able to see her daughter more, even exercising away from the unit, Alexis remained under section and could always be returned to secure psychiatric care if the authorities deemed it necessary.
And David said, what can we do to help? Because obviously the situation spoke to us quite clearly that there was something amiss.
So initially, the couple started to visit Alexis in care. And in a bid to get her section removed, then Dr. David Forsyth offered to act as an advocate on her behalf.
And every time I offered my services as an advocate to the consultant or to the review of her section, it was somehow sidestepped by time, by direct refusal, or occasionally just by disorganisation. And I felt a complete failure for that.
This setback aside, Alexis still expected her section to be removed when it came to review. However, in the early summer of 2016, she was detained for another year.
And that knowledge was just too much. And I ran to the cliff tops, which were near the unit, and I sat there, just looking out to sea, just wondering what on earth I was going to do. And my position at the unit being so precarious, because of course at any moment they could choose to move me to somewhere else, somewhere far away from my daughter like they'd done before.
Very quickly, staff tracked Alexis down.
One of the nurses came to the cliff and asked me to come back over, and I told her just to go away. I didn't want to talk to her, that I felt really betrayed. That I didn't need to be sectioned, I wasn't suicidal. And then this plainclothes police officer, she walked me back to the staff's car, and I got in the staff member's car just as I was shutting the door. the police officer opened the car. It was like a scene in a cartoon. All of these police officers came out from behind the trees and they ran towards me in all different directions, tied my arms together in handcuffs, tied my legs together. And the commissioners, the trust, or whoever it is that makes those decisions, told the police to let me go back to the unit. And everything changed in the unit from that moment. And I heard a number of times over the next day or two that they were going to transfer me to a secure unit, which is a higher security than an intensive care. I knew at that moment that I had to make a decision. Either I stay and I'm locked up somewhere far away from home in a medium secure facility, or I leave and I risk going there anyway. So I really didn't have a choice.
So in the hours that followed, Alexis planned an escape not only from her psychiatric care facility, but out of the country.
And so over the night, I contacted one of my friends that I'd worked with over in Asia. I had a phone in this unit all the time. And she was now living in Lagos, in Nigeria.
To protect the anonymity of her friend, Alexis has changed the name of the African city she intended to flee to. Making it to Africa, however, would put Alexis beyond the reach of the UK Mental Health Act, and in doing so, prevent her return to psychiatric care. She also worked out that she'd have enough money to live in Africa for at least 2 months. Enough time, she hoped, to legally get her section removed. To get there, Alexis planned to fly from Paris and in doing so, evade UK airport security. First, she'd need to break out of her psychiatric care facility and somehow get to France. She was going to need help. And it was then Alexis remembered a conversation with the then doctor, David Forsyth, and his partner, Jenny Middleton.
And they had joked one time that they would help me escape if I needed to one day.
What she was going to ask them to do, however, had not only the potential to completely change her life, but theirs too.
And I guess I wondered if they were going to be true to their word or if it was just a joke. So I gave them a call.
Next time, Alexis needs to find a way past border agents in 2 different countries.
And within a couple of seconds, there were a number of armed security with great big, those airport machine guns, those big machine guns they have. I don't know what they're called, but, big guns, rifle things. And they instructed me to follow them. And there were 2 in front of me, and then there was me in the middle and 2 behind.